Good morning, everyone. Hope you're doing well this Friday. This week I know has probably been rough for a lot of people because of the time change. I know for me, it's been hard and pretty tiring, but that could also be because I'm 37 weeks pregnant this week. And I'm talking today about insulin resistance because this is a hot topic, that a lot of people have questions about, and a lot of people who've joined recently in the group have asked questions about insulin resistance and weight loss and what do we do for PCOS and insulin resistance. So I'm gonna actually make a video on this on YouTube, but I wanted to come on here and kind of explain what is insulin resistance and how is it causing weight gain. Biggest thing when we're talking about insulin resistance is figuring out, kind of stepping back and thinking about what happens when we create insulin. So when we eat, for example, carbohydrates such as rice gets broken down into small molecules of glucose. So it's a carbohydrate. It's basically made up of chains and chains and chains of glucose. And the body just cuts down the chain into small individual molecules of glucose. So this is when our blood sugar rises in the bloodstream. And so what happens is when the bloodstream gets the glucose, the insulin is going to be created by the pancreas. So the pancreas sees the glucose, insulin gets produced, and the only job that insulin has is to store glucose away. So it's going to try to store it away into muscle cells so that we can use it in the form of energy. Sometimes what happens is a cell becomes resistant to insulin. And when this happens, what we end up seeing is that the cell actually becomes a fat cell. We actually then store that glucose away in fat stores. And sometimes we can store it in fat stores in the form of triglycerides in the liver or abdominal weight, especially around the midsection. So when we see that happening, it means that there's too much insulin and too much glucose. And mostly we have too much insulin because we're eating too many carbohydrates, or we keep filling the body with glucose without balancing blood sugar as we eat. And when this happens, that's when we start to see signs and symptoms of insulin resistance. This is not diabetes just yet when we have insulin resistance. However, if insulin resistance stays around for a long period of time and we have high levels of blood sugar, it can end up becoming diabetes, because now when we go do testing, our HbA1c, this is a marker for diagnosis of diabetes, we see this marker go up because we keep having long-term high glucose levels in the blood. I'll talk about lab testing in a second. But basically the signs and symptoms of insulin resistance in PCOS and in general actually are things like, obviously we talked about abdominal obesity, so weight gain around the midsection, cravings for carbs and sweets, darkening of skin. So we usually see this in the neck area and the fold, sometimes in the back or even in the front here. Darkening in your underarms, underneath your breasts, in between your thighs. So yeah, darkening of skin is a big one. Skin tags. So these are flaps, almost like your skin gets raised and then we see like a flap in the skin, and that can actually be a sign of insulin resistance as well. You can see those in the same spot, so on your neck, underarms, in your groin area, underneath your breasts, basically anywhere on your body for skin tags. And so those are two signs of signs of insulin resistance. We also have the signs of high testosterone are also signs of insulin resistance, because higher levels of insulin can actually increase testosterone. So we see things like acne, excessive hair growth, and hair loss, and these are also signs that the cause could be insulin resistance, and that's where the testosterone is coming from. Another thing to consider is sugar cravings and carb cravings. If we're constantly craving sugars and carbs, this can also be a sign that insulin resistance is present. So how do you know if you have insulin resistance? Well, you look at the signs and symptoms and say, okay, it sounds like I'm kind of hitting all of these criterias. And then also looking at blood work. So blood work gives us a really good idea of if we have insulin resistance. The few tests that we do in blood work that are very common, that I see a lot of practitioners running, are things like fasting glucose, fasting insulin, and HbA1c. So fasting insulin, fasting glucose, over 12 hours of fasting, we test the fasting insulin, fasting glucose. If levels are high, that means that, the cell is resistant and the blood sugar and insulin are high and we're not using it to get the glucose inside the cell. But when the other marker is HbA1c, this is a long-term view of glucose. This is the one that kind of helps us to diagnose diabetes. And what it is, it's hemoglobin in a red blood cell that's bound to glucose. So when hemoglobin is bound to glucose in a red blood cell, we can actually see it over time because a red blood cell actually lives for about 4 months. So we can see in the last 4 months how much glucose was bound to hemoglobin in that red blood cell. And that will tell us, our long-term view of glucose. If it's high, that means that glucose has been high for the last few months. So the higher the HbA1c, the higher the risk of diabetes. And actually, we end up diagnosing diabetes with that marker. Another test that's nice to do is that I use often is the insulin glucose challenge test. So this is similar to the oral glucose tolerance test, but as we're testing glucose over a 2-hour period after having 75 grams of glucose, we're also testing insulin at the same time. And I find that we usually catch insulin resistance when doing the insulin glucose challenge test, because now we're looking at both insulin and glucose. In an oral glucose tolerance test, you will only look at glucose over a 2-hour period, and I find that a lot of women actually end up passing the test if they don't have full-blown insulin resistance or issues with glucose. So when we look at the insulin glucose challenge test, we really want to see what's actually happening with insulin, more so than even glucose on the oral glucose tolerance, because a lot of people will pass that test and they won't pass the insulin glucose challenge test, and that's where we see the insulin resistance. So those are a few tests. Also urate, this is also a sign when urate is high that there's insulin resistance present. And then also looking at a cholesterol panel. So we look at triglycerides too. Sometimes when triglycerides are high, this is a type of fat that accumulates in the liver that can help us to see if there's fatty liver disease. And that usually comes from insulin resistance. So eating too much carbohydrates and sugars. So how do we treat insulin resistance? Well, the thing is, if there's too much glucose in the bloodstream, too much insulin, we want to start bringing down the glucose that we're putting into the body and help stabilize blood sugar. And the way we do that is, lots of good healthy protein, lots of good healthy fats and vegetables. These help to stabilize blood sugar. And then we use carbohydrates in that meal according to what's going on in the patient's insulin glucose challenge test, or their fasting insulin, fasting glucose, or even just their lifestyle in terms of how much glucose and carbohydrates we can get in based on where they're at. So, it's really about bringing the carbohydrates down. Another thing that really we've seen in the research that can help is fasting. Now, fasting for a long period of time, I found, can be too much on the body. So we really only want to be fasting for 12 hours. We want to eat when the light is out, and we want to fast when the light is down. So for example, we don't want to be fasting at breakfast time, in my opinion, because that can impact the circadian rhythm. So we want to be, eating from 8 a.m. to 8 p.m. and then fasting after that, and having good meals that are really nutrient dense, with lots of healthy fiber and fats and lean meats and protein, even vegetarian or vegan-based diets are also okay. They're just a little bit harder in terms of getting the protein in, but it's definitely possible. So when it comes to PCOS and insulin resistance, this is very common that we do see insulin resistance as the cause of PCOS for a lot of cases, and it's so very important to learn exactly what's going on in your body in terms of insulin resistance. If you're overweight and experiencing issues with weight, this is really important to get tested for. But even patients that are lean who aren't overweight also show signs of insulin resistance on the insulin glucose challenge, and also clinical signs and symptoms with their the skin signs that I kind of spoke about today. So I hope this was helpful. If you have any questions at all about insulin resistance and what to do and why it's happening and what does it mean, please comment below. Send me a direct message. I'm more than happy to answer. And stay tuned for my video on YouTube. I'm also going to go over I'm going to go over my insulin glucose challenge test and show you guys what the numbers look like and what they all mean and how you can diagnose insulin resistance with an insulin glucose challenge test. Hope this was helpful. Happy Friday. Thanks so much for joining me, and we'll see you soon.